Thank you very much. Your Excellency, the First Lady, Mama Margaret Kenyatta, Your Excellencies, Governors present, Cabinet Secretary of Health, Sir James Macharia, Your Excellency, the Ambassador to the United Kingdom, Resident, the Executive Director of UNFPA, the Chair of the Development Partner for Health in Kenya, Dr. Abbas Gulet, Secretary General of Kenya Red Cross, CECs of Health present, ladies and gentlemen. Of course, I'm sure a number of us are already angry, like me, because the statistics that are being shown to us are certainly very distressing. When graphically reminded that what we are discussing is a daily death rate of about 21 mothers, it's indeed a very sad revelation to all of us. Fortunately, we all have something to do. Fortunately, this matter can be handled by all of us if we indeed focus. I really want to thank the organizers of this important meeting for acknowledging this deep-seated challenge that continues to gnaw at the lives of the foundation of our nation, that are the mothers. Every year, Kenya loses upwards of 8,000 women from pregnancy-related complications, most of which are preventable. 50 years after independence, these are indeed scaring statistics, to say the least. The implication here is that in a country with a large population of women in the reproductive age, we are allowing preventable deaths from a condition that should be celebrated by everyone. Indeed, the young man who was singing and the video we were shown is that we should be celebrating motherhood. But it is a source of pain to a large number of families. Ladies and gentlemen, the Council of Governors agree with the First Lady, Her Excellency Mrs. Margaret Kenyatta, that no more women should die while giving life. Health being a devolved function, governors are today responsible for the promotion and protection of the well-being of its citizenry. And as a result, we must ensure that the right to life for every man, woman, and child is safeguarded. In this regard, there can be no negotiation on the improvement of quality health care for our mothers and the newborn. Ladies and gentlemen, maternal health care is a primary concern for all Kenyans, and as governors, we shall strive to provide a safe environment for our mothers to deliver and ensure that our health centers are equipped to do so. Through our county departments of health, we shall initiate campaigns and initiatives to encourage all expectant mothers to seek proper medical attention during pregnancy and especially at delivery. Ladies and gentlemen, today's meeting is not the beginning, but rather a strengthening of partnerships between the Council of Governors, the Ministry of Health, the First Lady's Beyond Zero campaign, the United Nations Population Fund, and other stakeholders, including international organizations and the private sector, to implement measures and strategies that will significantly reduce maternal deaths in Kenya. You will note that the county First Ladies already held a joint marathon and with Her Excellency, the First Lady, early this year. Indeed, a number of First Ladies are certainly in our midst here today, and I'm sure this is a demonstration of their serious concern. This not only jump-started the initiative at the counties, but also created awareness on this journey that we have begun. Indeed, as the Council of Governors, we met last, I think, a few months ago when we were doing the budgetary, when we were engaging the budgetary process. And we indeed agreed that we should mainstream the Beyond Zero agenda campaign, and that we put it as a specific budget line in our budgets for this financial year. Because it's not just a campaign, it is a very serious initiative that every one of us should put a lot of emphasis on. Ladies and gentlemen, we cannot have a Beyond Zero campaign without a draft plan of action. We must have strategies that we envision from experience and practice will encourage our mothers to take advantage of the government's free maternal health care. I know that we have expectant mothers who will still prefer traditional birth attendants. We shall ensure that these are trained to efficiently manage their clients to acceptable levels, but we should indeed aim at ensuring that everyone goes to the health facility closest to where they are. We shall ensure that these attendants are trained to efficiently manage their clients to acceptable levels. We want to assure them that we shall facilitate them and work closely with them as referral systems, particularly for the mothers living in remote and hard-to-reach areas. This will ensure that they take responsibility to ensure mothers deliver safely and have good postnatal care. Ladies and gentlemen, we therefore declare today that as the first elected governors of Kenya, we shall embrace and jointly own the Beyond Zero campaign in all our respective counties as the First Lady launches mobile clinics nationwide to increase the chances of life for majority of our mothers. We urge the private sector to team up with the Council of Governors to advance safe motherhood. With their resources, both financial and in kind, we can go a long way in achieving maternal and neonatal health care. Indeed, ladies and gentlemen, I would like to thank the Red Cross because they are and they have been in the forefront in assisting counties to deliver health care, to get our mothers and children to hospital through their very well-equipped ambulances, which they have put at the disposal of counties. I am one of such beneficiaries, and I would like to urge other counties to take this matter very seriously. It is one thing to buy a vehicle and brand it as an ambulance. It's another thing for that vehicle to provide ambulance service. These are two different things completely. Let's not cheat ourselves that we can buy vehicles, we can equip them, and we can get them to work. I've been in leadership for the last several years, and I have made those experiments. I have tried. And there is a very strange tendency. I have not been able to trace the reason. But the vehicles we buy, the tires tend to disappear overnight, however new. And the batteries keep getting extremely short life. And the fuel keep evaporating from the tanks. And the driver's phone keep going off after 5 o'clock. Matters to do with health care have no idea what time, have no idea whether it is 6 o'clock in the evening, midnight, or any time of day. That can only be managed by dedicated professionals. I have found that with the Red Cross. I have no brief to market Red Cross, but myself and I think a number of governors who have made use of that understand what we are talking about. Some people keep talking about the costs. We have to save lives. Ladies and gentlemen, the 47 governors are committed to intensify efforts that will ensure that Kenya meets the Millennium Development Goal number 5 by drastically reducing Kenya's maternal mortality rate by 2015. Don't remind me that it is only 6 months away, but we want to do it. This is in conformity with our new Constitution, Bill of Rights, which guarantees all Kenyans reproductive health rights. We will ensure an increase in budgetary allocation towards the provision of quality maternal and newborn health services to our communities, recruitment and training of more health personnel to meet the anticipated high demand for maternal and newborn services, and improvement of our infrastructural development to deliver enhanced services for all. We shall also educate our communities on the importance of seeking healthcare services from our government health centers. We are keenly aware that it is not just enough to provide or to build a dispensary. The mothers should be able to access it. Rural roads must be done. There must be clean, safe drinking water. We must be able to also look at food. When you get the child, are we able to take care of their nutritional requirements? These are the very basic agenda. These are the very basic concerns we as governors are faced with on a daily basis. And I want to assure you that we are doing everything possible to ensure that health services continue to function properly and more efficiently. And I would like at some stage, and I hope we will be able to do that, to show the improvements in health services in the counties. I saw the statistics here, and I would like to be, I saw a slight, an improvement between April last year and sometimes in November. And in December, there was a slight dip. Yeah? And I would like us to understand that in December, we had challenges in our hospitals. There were strikes. When there were no strikes, improvements were moving on. Yeah? But I want to also assure you that we are working together with the Ministry of Health and all other stakeholders to reduce the agitations in healthcare which are not helpful. In Mombasa, I want to assure you, I've been assured by Joho, they paid the salaries for health workers last week. There is no, we do not understand why there is continued agitation otherwise. But Joho has confirmed to me it was paid. Governor Homa Bay is also here. They are in, that sector has been taken care of. Let us all talk to ourselves and let's reduce the agitation in that area, because healthcare is a matter of life or death. Let's not play with it. We will work together with all the stakeholders to ensure that we are able to deliver this and that no child, no mother, or any other person will die when we can indeed provide the support we could. Thank you very much and God bless you.
Another warm round of applause indeed for Governor Ruto. Your Excellency, the First Lady, governors present, let me just remind all of us the context of our discussion, and indeed the viewers watching at home, that this is a consultative meeting on accelerating the attainment of MDG 5 in Kenya, with a focus in particular on 15 counties with the highest burden of maternal deaths.